Hi, welcome back to another session on Unacademy. This is Unacademy Future Doctors, and I am Dr. Shivangi Shukla. I welcome all of you to tonight's session. Let me just check if the live stream has started. Yeah, so I'll just check if I'm visible and audible to everyone, and then I'll resume. Okay, so we have just finished one session, the first part of clinical, the third clinical application session, and that will be divided into two parts because that is a slightly lengthy session. So I'll be taking the next session tomorrow or day after tomorrow. And this session is an image-based session. I've taken a lot of such sessions, image of the day, mnemonics of the day, all right, mnemonic of the day. So and yeah, following this there will be an open house session at 7:40 p.m. where you can ask me anything regarding your doubts, your regarding the doubts of your preparation in your studies, in your academics. Okay, understood? So, I'm Dr. Shivangi Shukla. I have passed out from Lady Harding Medical College and I have done post graduation from MAMC, Maulana Azad Medical College. Regarding I'll just quickly discuss about the NEET PG subscription that is available on the Unacademy app, the Iconic as well as the Plus subscriptions. Now, both of these will provide you access to video resources from top educators across the country. They'll be taking video lectures, they'll be clearing your doubts, they'll be taking extensive discussions covering all the syllabus of all the 19 subjects in your medical curriculum, and they'll be giving you regular, timely, periodic tests, quizzes. Okay, and all these things are will be simulating the physical classroom environment. So you will sitting at the comfort of your homes, you will have the feel of a classroom, and you can watch these lectures on any device of your choice, be it iPad, phone, laptop, whatever you wish to, or your PC. Okay, and the Iconic subscription will also give you resources from Prep Ladder as well. It will give you access to resources from Prep Ladder. Now the special classes, these special classes are absolutely free. They are occurring every day. Every day, some of the other educator is taking special classes, and there you have interactive polls, raise your hand feature, and a lot of other features that will simulate the classroom. Okay, now one very important announcement: the subscription prices, the regular prices are these, but before midnight tonight, if you apply the educator code DRSHUKLA, if you apply the educator code Dr. Shukla, DRSHUKLA, and take the subscription, either of the subscriptions, be it Plus or Iconic, you will be in for 20% discount. 1/5 of the total prices will be slashed off. Okay, so Dr. Shukla is the code that you have to apply, remember. And last few hours left for this amazing offer to end, because after that, Unacademy will be hiking its prices. So please, guys, utilize this opportunity to your benefit and do subscribe to Unacademy using my code DRSHUKLA, Dr. Shukla, and unlock 20% discount. It is a huge amount, guys. You will be only paying very little, and that too, that is already, that 80% is of the subsidized price. So already, can you see, these prices are so low, so reduced. You will not find such low prices in the market, and you are getting the best teachers, the best educators that are there. and we are not just giving you rote lectures, monotonous lectures, but very interactive classes, diverse variety of classes, interactive sessions, so many resources, books, materials, question banks, so many things we're giving, regularly timed sessions, also open house sessions, 1:1 audio doubt clearing sessions are there. After this session I'm having another open house session with you guys. So many benefits which won't be given to you in a physical setup also. So please make good use of this, guys, and I think it is it will be very beneficial. It will be a very good bargain if you take the subscription before 12 a.m. midnight tonight. And do not forget to put in the code Dr. Shukla, DRSHUKLA, for the 20% discount. Alright. So let us begin. Alright. Now this is one image. This is the some disease that we're talking of. I'll give you 5 minutes to diagnose this, and you have to give me, okay, the questions I'm writing. The question is A, what is the diagnosis? And B, what is the cause? One important cause, okay, and the diagnosis. So write answer in A and B in the chat section. 5 minutes you have to answer, okay. Your time starts now, okay. Within 5 minutes all of you should answer. Write A, what is the diagnosis? B, what is the cause? Okay, both of these pictures are of the same disease, okay. So just tell me, there are two questions. One is diagnosis and B is the cause. Tell me, come on guys, answer in the comment section. Come on, 1 whole minute has already elapsed. 4 minutes left for you to answer. Okay, last 2 minutes left. Come on, everyone. Last 2 minutes left. Come on. All of you, do not be shy. Do not be shy of answering. The maximum that you can do is answer it wrong. Doesn't matter. But what is worse is not attempting. Okay, because this is how this mental barrier of apprehending, this mental barrier of the apprehension that you develop while seeing questions, and the diffidence that you have while answering, coming up with the answer, even if you know some part of it. This is what you have to break, because that is how you will be confident enough, that is how you will start attempting those MCQs about which you are not extremely sure of. And this is what happens in the entrance examinations. You're not sure of most of the questions, so you just have to attempt, venture with an informed guess, and that is what this is how you have to, you will develop your skills if you attempt questions right now. Otherwise you will be very diffident, you will not be very, you'll always be uncertain of going ahead with the answer. Okay, so there is some kind of an aptitude that you have to develop for solving multiple choice questions, because first, even though multiple choice questions seem to be easy because you have the answer in front of you, the answer is either of the four options. But this is what is the beauty of it, and this is what is the how MCQs are a double-edged sword, because the four options are so close, that you have to be very confident of going ahead with one of them. They are very close together. Okay, all right, so I think last 1 minute left, and then I'll be telling you the answer for this. Okay, come on, all those who haven't answered, do answer this. There are two questions. This is one image. These are two images of the same disease, and there are two questions that I have asked of you. One is A, what is the diagnosis, and B, what is the cause for this disease. Okay, one major cause. This is very common, time and again we have discussed. This is the characteristic, and this pattern of distribution is also, this has a term. Okay, last 1 minute left. Try and answer this, and then I'll tell you the answer. Okay, in the last session I gave you two homeworks. Do attend that session and please answer in the comment section whatever questions I have asked. There are two questions that I have asked you. Please answer them. Okay, all right, so the time is up, and now I'll be telling you the answer. First, what is the diagnosis? The diagnosis is pellagra. The diagnosis is pellagra. And what is the cause? What is the cause? The cause is deficiency of which vitamin? Niacin, isn't it? Now, one tip that I would like to give you is, do not answer whenever you're asked the diagnosis in your exams, in your subjective exams, not in the MCQs. In the MCQs, you have to answer just one question. But in the subjective exams, whenever you're asked with the diagnosis, do not just come up with one diagnosis. You have to answer differential, you have to give the differential diagnosis. Okay, that is, for anything there can be more than one diagnosis. Okay, so you have to come up with the closest diagnosis according to the clinical history and examination, and then the following diagnosis that you can come up with. After that, you have to tell, then we can exclude the other diagnosis using these particular investigations. Understood? So here, if you have to answer this as a case history, you will say this is photodermatitis. This is dermatitis. And what will be the examination findings? Hyperpigmentation, and inflammation of the skin, inflammatory hyperpigmentation of the skin, scarring of the skin in the exposed parts, okay, near the neck, in the distribution of the necklace, okay, in a particular distribution as a necklace, okay, seems to be suggestive of Castle's necklace of pellagra, okay. The other diagnosis can be such and such, okay, photodermatitis, and whatever, lichen planus, whatever, what else diagnosis you can say, pemphigus, pemphigoid bull, whatever other diagnosis you can come up with, those you can mention, okay. But that is another thing. Right now we are going to discuss about pellagra, okay. Now pellagra is, as we already saw, it is due to deficiency of niacin. Niacin is a B vitamin, okay. Now niacin is formed from, in the body, come on guys, what is the amino acid that produces niacin? It is tryptophan. Now tell me, at least answer in the comment section, is tryptophan an essential or a non-essential amino acid? Come on. Is it essential or non-essential? Tryptophan. Come on. Anyone? Is tryptophan essential or non-essential? Tryptophan is an essential amino acid. It has to be mandatorily in the diet, mandatorily in the diet, for its deficiency to not develop, okay. And tryptophan converts to a lot of important compounds in the body. For example, serotonin is an important neurotransmitter. Then melatonin is what? It regulates the sleep-wake cycle, the circadian rhythm, and it converts to niacin. Now 60 milligrams of tryptophan, 60 milligrams of tryptophan give rise to 1 milligram of niacin. Okay, understood this? 60 milligrams of tryptophan will give rise to 1 milligram of niacin. Alright, now the deficiency of niacin is called pellagra. It is characterized by a triad, a very important triad. In addition, you have other symptoms also, but these are the three important symptoms that are characteristic of pellagra. Can anyone tell me these three symptoms? One of these we have already seen, the dermatitis. So we'll write here dermatitis. Dermatitis is inflammation of the skin. Itis is inflammation. Derma is skin. Inflammation of the skin. Okay. What are the other two? Anyone? What are the other two? One is diarrhea. And the third one is, there are these three D's. The third one is dementia. So what are the three D's of pellagra? Dermatitis, diarrhea, and dementia. The three D's of pellagra. Okay. Now, if these three D's are not controlled, if they are not cured in sufficient time, then it can lead to the the fourth D. And what is that? It is death. So, niacin deficiency can be so severe as to lead to death also. Okay. So, dermatitis, diarrhea, dementia. Now, we'll talk about dermatitis. What type of dermatitis is there in pellagra? It is a photodermatitis. That is, it occurs in the areas that are exposed to the skin, to the sun. So, exposed parts. Okay. And how does it occur? The skin is inflamed, red. There can be small bullae also. There can be small lesions, inflamed lesions. Skin can turn flaky. And later on it turns hyperpigmented. Now it is characteristically in the distribution of the necklace. in the neck that is called Castle's necklace. Okay, understood. So this is how the dermatitis of pellagra is. Okay. Now, one very important thing, there is primary pellagra or primary niacin deficiency, and there is secondary niacin deficiency. Primary is when there is no other disease, okay, no background disease. So, due to dietary insufficiency of niacin or dietary insufficiency of tryptophan, there is there is development of pellagra. Secondary, there is in the backdrop of a systemic disease. In the backdrop of a systemic disease. The most important one here is, any of you, what am I talking about? A disease, a systemic disease, autosomal recessive in inheritance, which leads to tryptophan deficiency and subsequently niacin deficiency. What is this disease? Come on. This is Hartnupp's disease. Hartnupp's disease, okay? What is Hartnupp's disease? Anyone? Can any of you tell me what is Hartnupp's disease? Okay, so there is defect in Hartnupp's disease. What happens is, first of all, it is autosomal recessive in inheritance. So, autosomal recessive diseases, they get magnified or amplified through consanguinity. Okay. And so what happens is, what is the main characteristic here? Amino acid absorption or amino acid transport is, or absorption is affected. So therefore what happens is, because tryptophan is a large neutral amino acid whose transporter is there in the intestine, in the kidney and in the brain. Okay. So the transporter does not function. Now what happens is, all the tryptophan is excreted through the kidneys and the intestines. Okay. And what happens is, because it is not crossing the blood-brain barrier and entering the brain, the neurotransmitters are also not getting formed. So Hartnupp's disease affects the brain and the skin. How the skin? Through pellagra, through dermatitis. And it also affects the brain, causing dementia and other symptoms of tryptophan deficiency. Because tryptophan is deficient, melatonin will be deficient, serotonin will be deficient. Understood? And it is excreted through the urine and the stools, through the intestine and the kidney. Okay? So this is what is Hartnupp's disease, deficiency of tryptophan, subsequently leading to deficiency of niacin. Now, how many milligrams of tryptophan form 1 milligram of niacin? Come on, we have read this. Tell me. Are you guys following this or not? Are you guys following this? How many milligrams of tryptophan lead to 1 milligram of niacin, guys? Come on. 60 milligrams of tryptophan will lead to 1 milligram of niacin. Also, one very important thing is, apart from these, the other features of B complex deficiency like dry mouth, inflammation of the mucosal membranes, all these are also present in niacin deficiency. Okay, so treatment is what? Treatment is supplementation with niacin, supplementation with tryptophan. Alright, this is what is the whole summary of this session. Alright, now yeah, talking about tryptophan, we'll also quickly see how tryptophan leads to the production of serotonin. Tryptophan forms 5-hydroxytryptamine, which 5-hydroxytryptophan to tryptophan hydroxylase enzyme. Then it forms serotonin, which is 5-hydroxytryptamine. and then this forms melatonin, which is formed from which enzyme? Yesterday only we discussed in the MCQ session. Come on. सेरोटोनिन इज स्टैंडिंग, सेरोटोनिन स्टैंडिंग, जब उसको मार पड़ी तो मर गया मतलब गिर गया. सेरोटोनिन हिट मेलाटोनिन, सेरोटोनिन स्टैंडिंग, व्हेन इट इज हिट इट इज मरा हुआ मेलाटोनिन. सो हिट इज हिट एंजाइम. This is hydroxyindole methyl transferase enzyme. Very important, very important. Okay. Now, this melatonin is involved in the sleep-wake cycle or circadian rhythm. Serotonin is involved. It is a neurotransmitter. Okay, serotonin deficiency leads to low mood, depression, cyclical depression, dysthymia. Melatonin deficiency also leads to this dysthymia or cyclical depression. Okay, understood. So, yeah, selective serotonin reuptake inhibitors are certain drugs which are used in to treat depression, low mood, psychosis, all these things. Okay, so, not psychosis, but depressive symptoms, depression, anxiety, all these symptoms. Okay, depression and anxiety. There are SSRIs, selective serotonin reuptake inhibitors. If serotonin reuptake will be inhibited, then serotonin levels will be increased. Serotonin levels will be increased, so the person will start feeling good. His low mood will rise. Low mood will improve. Understood? So this is what we have discussed. Let us just quickly revise what we have discussed. So this is about the dermatitis. This is about pellagra. Pellagra is due to deficiency of niacin. Okay. Niacin, 60 milligrams of tryptophan form 1 milligram of niacin. Niacin is formed from an essential amino acid, that is tryptophan. Tryptophan is an essential amino acid. The deficiency of niacin leads to pellagra, which is characterized by 3 Ds, that is dermatitis, diarrhea and dementia. If these are not controlled in time, then it can lead to the 4th D, that is death. Okay, look at this. Dermatitis, inflammation of the skin. Diarrhea because of inflammation of the mucous membranes. Okay, and dementia. Why? Because they're not, the blood-brain, the neurotransmitters are not getting formed. Okay. Then dermatitis is characteristically photodermatitis, that is, it occurs upon exposure to the sun, and what happens? The skin becomes inflamed, there are inflammatory lesions, it can start bleeding, it can start oozing liquid, right? And hyperpigmented, flaky, it can also lead to the formation of scars. Scarring. Okay. And it occurs mostly in the exposed parts like the hands, the arms, the neck, the face. Okay, and in the neck, it appears in the distribution of the necklace, that is the Castle's necklace. Okay. Now, the deficiency of niacin can either be primary or secondary. Primary deficiency is when there is just the dietary deficiency of niacin. There is no particular, there is no other cause. Okay, it is just due to deficiency of the vitamin or the amino acid tryptophan. It leads to, so there is no background systemic disease. But secondary deficiency is when this occurs as a result of another systemic disease. The most common one which we should study is Hartnupp's disease. Hartnupp's disease is an autosomal recessively inherited disease. Any autosomal recessive inheritance gets aggravated or gets amplified through consanguinity. And what is the basic feature? What is the basic etiology in Hartnupp's disease is the amino acid transport of large neutral amino acids, transport and absorption is affected. Now, so what happens is tryptophan is one such large neutral amino acid. It gets excreted through the intestines and the kidney. And what happens is its absorption in the brain, its passage through the blood-brain barrier along the large neutral amino acid transporter is affected. Now, if it cannot reach the brain, what will happen is it will not form neurotransmitters, And once neurotransmitter formation is not occurring, then the brain will be affected. Also, because niacin will also not be formed, so what will happen? Mucosal surfaces and skin, they will also be affected. So these are the two main tissues which are affected in Hartnupp's disease, brain and the skin. Okay, 60 milligrams of tryptophan forming 1 milligram of niacin. All these things are the takeaway from tonight's session, and I hope you guys have understood the basics of pellagra, which are important for your consideration. And now join me at 7:40 p.m. That is in about 5 minutes from now. Join me on in the open house session on the Unacademy app, where I'm conducting a session on Ask Me Anything. It is an audio 1:1 interactive session where you guys can ask any of your doubts, be it academic doubts, be it any question that you're not understanding, any doubt that you have in any concept, or any strategy session, any strategy doubts regarding strategy, anything, belief regarding time management, whatever you wish to ask me, you do ask in that open house session. It is a 1:1 audio interactive session. So you can ask me your doubt and I'll answer it to you, just like you're talking to me over phone. Okay, so this Unacademy has come up so that students are less jittery and they have some mentor to talk to speak to, and clear any of your doubts. Okay, so do not be shy, do not be apprehensive, just come up with doubts. And privacy is also maintained because it is not a video session, it is an audio session. So you need not bother, you need not be shy enough. All right, understood. So join me at 7:40 p.m. on the open house session. How do you join it? You download the Unacademy app. Okay, go to the NEET PG. Now they'll ask you what is your goal. Click on NEET PG and then search for Shivangi Shukla. Okay, there you will find my profile. You can follow me, and then on my profile only you will see the open house session which is scheduled. You join that session. All right. So that is how you join the open house session. So please do that at 7:40 p.m. and I'll see you there. So come up with. I'll be very happy to solve all your doubts. It is a half an hour. It is a half an hour session. So you have a lot of time to clear all your doubts. Okay, guys. See you then. Bye bye. See you on the Unacademy app in about 4 minutes from now. Bye. Take care.